If you're a breast cancer patient, do you need to be taking supplements in addition to your regular diet? Huge amount of discussion in this country about supplements. My goodness gracious, everywhere you go, people are talking about supplements, and yet there are plenty of people say, well, wait a minute, I eat a healthy diet. I don't need to be taking supplements. What advice can we give our breast cancer patients?
It's interesting because I think that healthy diet is critical for so many aspects of survivorship and just normal life, even if you're not a breast cancer survivor. Healthy diet is what we all strive to do and to maintain. But for some essential nutrients, like vitamin D, it's really hard to get it from your diet. You can eat lots of fish and drink fish oil, but it's pretty nasty. So if that's a sort of component of your diet that's really robust, if you measure your vitamin D, it'll tell you if you're in the sufficient or insufficient range. If you're not, supplementation is the best way to do that.
And we shouldn't be doing supplements willy-nilly. So we really need to measure our vitamin D level. We need to know what the baseline is, and then take the supplements accordingly. Do you want to lead us through that?
Yeah, so I think that's a critical difference about vitamin D supplementation and so many of the other things that we try to supplement for all sorts of reasons. With vitamin D, we have very accurate measurements that can be made clinically. Breast cancer patients, physicians can measure the vitamin D level. You can determine what sort of dose you need to take to get it up to the acceptable range in the 30 to 50 nanogram per mil range. And you can take the supplement and then you can measure it 3 months later, and if you're there, you just can maintain with even with a lower supplement level then. Or maybe at that stage your diet will be able to sustain it, with your activity level, and so you can track your level over time, and if you need to bump it up in the winter because you don't have much sunlight exposure, then you can bump it up again.
Okay, very good. So one of the things people need to measure besides their weight and staying healthy and eating the healthy diet, they need to know their vitamin D. They need to know that they may not and probably won't get it all from their regular diet. This is really critical advice for breast cancer patients.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.